Hello, and I am very excited to do our very first the real cost of fertility preservation webinar. Before we get into it, my friends, I would like to begin today, as always, by acknowledging the traditional custodians of the land on which we are recording this webinar today, the Wurundjeri people of the Kulin Nation, and we pay our respects to elders past and present, and we share our friendship and our kindness. Now, I am genuinely so excited that we are doing this webinar today. It has been a long time coming. I get so many questions, so many DMs about people saying, hey, we would really like to know more about IVF. But at the end of the day, that is not my place, which is why I have been lucky enough to secure Dr. Nicole Hope, who is a highly experienced and very compassionate fertility specialist and just also the medical director at Newlife IVF, who's been assisting couples to conceive babies for almost 20 years. Nicole, welcome to the She's on the Money community.
Thank you.
I am genuinely so excited about this. I feel like, are people saying I'm frozen? Am I still frozen, or was I frozen and I've unfrozen? Just checking. I can see in the chat, was that just a one-time thing? Nicole, you can see me, right?
Yeah.
Okay. All right, fantastic. Now, this is obviously a relatively sensitive topic, and if you're here, I am very excited that you're here to talk about this, but I want you to know that if it's a bit overwhelming or it's all-consuming, there is going to be a replay of this that's going to be sent to your emails after. So if you're like, look, this has been fun, and hopefully all of it is fun and all of it is really educational, but I just want you to know that, like, this stuff is really hard sometimes to talk about. As someone who went through her own fertility issues, I just know that there are times in my life where I was like, oh, I'm so ready for this. And then I would be, and I'd be like, oh, actually, I'm not right now. So I just want to acknowledge that before we go on. But let's dive in. Are you ready, Nicole?
I'm ready. Yeah.
Dive in? All right.
Sure.
So first things first, we're going to talk mostly about egg freezing and IVF. But first cav off the rank, I'm going to actually get our slides up so that we can have some resources. Sorry, I just remembered I did a really pretty presentation and I need everyone to see that too. So we're going to go a little bit small. See, look, cute, right? So the first process I want to ask you about, and this is just like a few little resources for you guys. We will circulate this document as well, don't worry. Can you talk to me about what is egg freezing? What's the purpose? Why would we do that? And how does it work?
Well, I think most people are aware now that for women, the single biggest thing that kind of predicts whether we can get pregnant is our age. For women, we're born with all our eggs. We're born with about 1 million eggs. By the time we even have our first period, we're down to about 300,000 eggs from 1 million at birth. And then
so they're already leaving before he even had a period.
Yep, they're on their way out. And ultimately, we keep losing eggs all the time till we go through menopause, which is when we have finally run out of eggs. As well as our egg number decreasing as we get older, the other issue that happens is egg quality. So our eggs are a bit like our skin. So as we get older, just like we start to get some wrinkles in our skin, with our eggs, there starts to be some cellular damage that happens and our body isn't able to repair that. So when we are young, our eggs are lovely and healthy, but as we get older, the eggs that we release start to be damaged, and we see that the pregnancy rates go down, and unfortunately the miscarriage rates also increase. So basically the purpose of egg freezing is to try and freeze eggs, A, while we still have them, and B, while we're younger and hopefully we have better quality eggs. And then we can use those eggs if we need to at a later date. And so if we come back and we're 45 and we frozen eggs when we were 35, then we are actually, our chances of pregnancy are that of a 35-year-old.
That is really exciting because like obviously I now know a fair bit about this process because I've done my own research to make sure that I, am educated for this webinar, but just the idea that you can kind of preserve that age as though, okay, well, I don't want to have a baby today, but I would like the same opportunity. It's very similar, right?
Yes, very similar.
So in comparison to that, so egg freezing is one thing, but the next is IVF. And what is that and how does it compare?
So the egg freezing process, as a process, it's about a 2-week process. We typically start with the woman's period and then she will take hormone injections for about 10 days. With these hormone injections, usually she will take 1 or 2 injections a day, and they're usually in like a pen device, a bit like an EpiPen or insulin pen. One of the injections is to try and get multiple eggs to grow, and the other injection is to make sure you don't ovulate too early. Most women are ready for their eggs to be collected by around day 13, day 14 of treatment. And so when you do egg freezing, the eggs are frozen on the day that they're collected. If someone is doing IVF, they will do the exact same process, but on the day that the eggs are collected, instead of being frozen, the eggs are inseminated with sperm.
Right.
We then grow the embryos that result in the lab for 5 days. And then the patient will come back in and we can put an embryo back into her. And then a week and a half later, she's having a pregnancy test. So IVF and egg freezing are the same up to that end point at sort of 13, 14 days. And then with IVF, it's taking it that extra step of actually creating embryos to get pregnant.
Yeah, it's crazy how much I didn't know about this process and what that, that kind of looked like. And I was really interested when I started, learning a bit more about, this IVF process, how it actually replicated in a way, and you can correct me here, replicated like your actual cycle process. So you've kind of like got your period and then you've got that period before you ovulate and then you've got your ovulate. And I was like, oh my gosh, this makes sense as to why you do it this way.
Yeah. The body has it all worked out, and everything we do is actually trying to mimic or replicate what happens in the body, just maybe a little bit supercharged. So naturally, women tend to just ovulate 1 egg a month. And obviously, we're trying to get a good little batch of eggs to freeze.
Yeah, I feel like that really helped me mentally to go, oh, okay, so like this process, because I often hear the conversations where people say, oh, I went through, 3 rounds of egg collections. And I'm like, what's a round? Do they just go, oh, okay, you can start today? But clearly that's not the case. So am I assuming correct that to start an egg freezing process, you actually have to like have your period and start at that point, and we aren't just going in any day and going, can you freeze my eggs today?
Yeah, that's exactly right. So you do need to have some hormone injections for, as I said, about 10 days leading up to the egg collection. We generally like to start with someone's period because I think in some ways it's sort of, I guess, more intuitive for someone to do it that way. But when we have, for example, patients who maybe unfortunately have been diagnosed with a cancer and maybe they have to start chemotherapy and they need to do egg freezing because sometimes chemotherapy can actually damage or harm the eggs, we will just start egg freezing wherever you are in your cycle.
Just get it done at that point.
Start, but you still really need to have that 10 days of hormone injections.
Yeah, no, now we've got a Q&A session at the end, and as you guys know, Jess from She's on the Money, she's hiding out in the comments right now, collecting all of the comments to make sure that we don't miss anything, and we'll bring them up at the end. But Nicole, do you mind if I ask some questions as we go through this? Because I feel like there are some ones that I'm like, oh, that is really relevant. I'm thinking about that.
Yeah, sure.
So Ebony's asked, is there like an age cutoff when we're talking about egg freezing?
Yeah. So It is possible that some clinics do have age cutoffs. A lot of clinics, it's a self-imposed kind of age cutoff. What I would say is, what we know is the older you are, the less chance of success you will have with egg freezing. And as a general rule, we don't sort of actively promote it or encourage it for women over 40, because we know that even if we freeze many eggs, there is still a chance that they're not going to have a baby from that. And it doesn't seem sort of ethically right to be putting someone through rounds of IVF and without sort of a reasonable chance of being able to have a baby from those eggs. Having said that, as a doctor, you always have to look at someone's situation as an individual, and I will sometimes do egg freezing for women over 40, but making sure they're adequately counselled and have realistic expectations about what their chance of success is. So I think it's, recommending the treatment that's right for the patient, but also allowing the patient the autonomy to decide what the right thing is for them.
Yeah, and I think that's like, I feel like that would be a really important part of your role, and also kind of like a hard part of your role. Like, it must be really challenging when you've got someone who's come in and they're like, I didn't know I could do egg freezing, and I'm 40, and you have to have this like ethical conversation as well as like a, look, this might not be the right thing conversation. But I guess that's the role, right?
That's right. And yeah, sometimes I do have patients where they do really want to have a child, and maybe egg freezing is not going to be successful for them. And sometimes we might even talk about, well, maybe rather than freezing eggs, do you actually just want to try and get pregnant, for example, using a sperm donor? Or sometimes we say, look, where this egg freezing isn't going to be really successful for you, let's not do that. If down the track you do really want to have a baby, there are some other options you can consider. So through IVF, there are things like egg donation and embryo donation. But obviously there are other strategies to have a family, like fostering and adoption. So there are other options. But it's important that you do discuss with your doctor how many eggs are you likely to get, and what's the actual chance of those eggs resulting in a pregnancy for you.
Yeah. And that's going to be just so personal. That's not something that you can go, okay, well, if you're 30, your chances are X, and if you're 40, your chances are Y. I'm assuming that there are some 30-year-olds who have really low egg count, and some 30-year-olds who you'd be like, you don't need to freeze your eggs.
Correct. That's
right. So we really do, if we want to explore this option, really do need to kind of like finally see a professional.
Yeah, so when a patient comes to see me, as well as sort of taking a bit of a medical history and gynecological and pregnancy history, I will order a bunch of blood tests, and a lot of these are hormone tests, and in particular there's one hormone I will order which is called an AMH test.
Oh, that's not come up in the comments. So yeah, what's an AMH test?
Yeah, so AMH stands for anti-Müllerian hormone, and this is a hormone which is made by each and every one of your eggs. And so basically, the more eggs you have, the higher your AMH level. So it gives us an idea about what we call the ovarian reserve. So how many eggs do you have left? When are you likely to go through menopause?
Yeah.
And then I will also usually get someone to have an ultrasound and to have a look at your uterus and ovaries. And when we're looking at the ovaries, what I really want to see is something called an antral follicle count, which means the person doing the scan counts how many follicles or eggs they can see on the ovaries. And so that will enable me to say to a patient, I think if we do an IVF cycle, we'll be able to get 10 eggs, or I think we'll be able to get 5 eggs. And that's really important. And especially from your perspective of looking at finance, if I'm saying to you, you need to get 20 eggs to give yourself a good chance of having a baby, but I'm also saying to you, hey, we may only get 5 eggs per go, then for you to get 20 eggs, you may have to do 4 rounds of IVF. And so you do need to know that up front.
Yeah, I feel like that's really helpful though, because I was in my studio today recording my podcast, and I had the privilege of recording another money diary, and I was talking to a woman who had gone through IVF to have her 2 beautiful babies. She has a 1-year-old and a 3-year-old now, and she was saying, my IVF process, she's like, we were heartbroken. Like, we got 4 eggs, and then, a couple of days later, or whenever it was, her doctor called and said only 1 embryo has been created. And obviously when you're going through this process, I feel like people want more, and people want a few of them, and they decided to go through the process again, and same results. They only had 1 embryo from 4 eggs that they collected on the second round, but both of those embryos are now babies. So I think I was like, I'm so glad you're sharing that, because like I've got friends who go in for egg collections and they're really heartbroken with the number. But I mean, she and lots of people go through lots of rounds. I also have another friend who has gone through, I think she's been through 23 rounds of IVF, and that's heartbreaking. But like, everybody's different, and I just think it's so important to talk about so that we can kind of set our expectations. So I'm feeling like this AHM stuff is kind of about setting expectations for you and for me. And what would happen if you're like, oh, your AHM levels are off, like we don't think this is going to be successful? What happens?
Yeah, so as you were just saying with your friend who only had 4 eggs and got 1 embryo, but they both resulted in babies, the reality is that the quality of the eggs and the embryos is actually the most important thing.
Right.
We actually don't have a test to see what your egg quality is like. We have to estimate your egg quality, and we know the single biggest predictor of egg quality is your age. And unfortunately, as you are older, we know the egg quality is less. But as I said, if I have a young person who has a low AMH, maybe freezing eggs is not going to be very successful for them, but that doesn't mean they can't get pregnant. And sometimes I have people freeze eggs for different reasons, and some people potentially just want to delay having children, but possibly could actually, they're in a situation where they could try naturally now. And so sometimes for those people, I will say, look, I know you were planning to buy your house and do all that before you get pregnant, but your AMH is low, so why don't you actually just try naturally now? And it is actually amazing how a lot of those people won't actually have any trouble getting pregnant.
I love that though. I love that. And I feel like sometimes, especially as women, we're like, no, we really want all our ducks in a row. Like, we want to do this, we want to do that. Like, and, egg freezing might make a lot of sense in your head. And then you get into a room and I get to sit down with you, Nicole, and you go, Victoria, what's stopping you? Like, I know you want to buy a house, but like, I feel like sometimes we just need the validation of a professional to say, like, people in your situation often just try and it works out. Like, and sometimes we just need that push, which is a good conversation, because I want to talk a little bit more about the costs. Like you mentioned, like sometimes people are coming to you to literally talk about fertility because they're like, look, I'm just not at the stage in my life that I thought I would be in financially.
Yes.
Let's talk about the cost of fertility treatments. Can I just ask straight out, what's the average cost of an egg freezing cycle?
So basically, I can see your little chart up there. And
it's cute, isn't it?
Yeah, very cute. So just to explain to your viewers, the pink column is looking at what we call medical egg freezing. So this is egg freezing where your doctor has deemed that you should do egg freezing for medical reasons, and therefore you're entitled to Medicare rebates. Whereas the orange column is called non-Medicare, and that's where, say, we have someone who is very young and they have a lot of eggs and there's no reason for them to do egg freezing except maybe for their own peace of mind. And so because of that, that doesn't attract Medicare rebates. So with the pink column, there are sort of a few different fees listed there. So the top line says seeing a fertility specialist for a first appointment, and those appointments are usually somewhere around $250 to $300. There is a Medicare rebate for that appointment as long as you have a GP referral for that.
Yeah.
At Newlife IVF, so these are the costs from Newlife IVF, and other IVF clinics may have different fee structures, but what we call out-of-pocket cost is just over $4,000 for a first round of egg freezing. When you do your first round of egg freezing, you do hit what's called the Medicare safety net. And what that means is for the rest of the calendar year, you get more Medicare rebates from any medical care, not just IVF, but even seeing your GP or doctor's appointments, you get more money back for the rest of the calendar year. So that's January 1 through to December 31.
So does that mean that you should be sneaky, and if you're considering egg freezing, maybe like doing it at the start of a year in case like something is that too cheap?
No, you can. Or it is also possible to do egg freezing sort of back to back as well. So you can do one round, and as long as you're feeling well enough, you can actually sort of launch into a second round soon after if that's what you are wanting to do.
Yeah, that's so good to know, because I haven't been through this process myself, but these are all questions that I'm like, oh, what about this? How would that work? And you probably get bombarded with this on a daily basis. So I do apologize, but we're really grateful.
No worries. So you can see on the second line, it says if you do a second cycle or subsequent treatment in the same calendar year, Medicare actually give you back an extra sort of $600 or $700 for that cycle. Now, it lists their medications. The medications are mainly covered by Medicare for a medical egg freeze cycle. So we've sort of said the fee is sort of $200 to $400, and it actually depends how many medications you're taking. Now, when you have the egg collection, there are some IVF clinics that may do an egg collection awake, and they may do it in an office setting without an anaesthetic, and that can reduce fees. At Newlife IVF, we do tend to give people an anaesthetic, and
that made me cringe a little bit. I'm not going to lie. I was like, without anaesthetic?
Yeah, well, they may give some local anaesthetic, but we give a light anaesthetic. It's what's called sedation. And the procedure takes about 10 minutes. So you're only asleep for 10 minutes.
Is that like the same? Because I used to have a Mirena. Happy to talk about it, but I used to have a Mirena. Is that the same type of sedation I would have experienced? I think they called it like a twilight, where you're out, but you're not like completely out. You just don't remember it. You don't feel it.
Correct.
Is that right?
Exactly right. So so usually it's mainly just some anaesthetic medication through an IV drip and just an oxygen mask. So it's very low key.
Very different to going in for a very big surgery.
Yeah.
which I think it's, I don't know, I feel like that would make the whole process less traumatic. Is that a good way to put it?
My personal experience is I don't have anybody complaining about being asleep for the egg collection.
No, that makes sense. All right, we won't go too much into that.
We won't go into that yet.
No.
But, so there is an anaesthetic fee of just under $400. So that's from the anaesthetist.
Yep.
Now, for patients who have gold level private health insurance, things like the anaesthetic fee and the hospital fee may be covered. But unfortunately for IVF, you do have to have that top level gold cover. And usually when you have your first procedure or hospital admission for a year, you do have to pay your excess, which is often around $500. But again, it means any other surgeries you have in the year or hospital admissions, you've already paid your excess for the year.
Yeah.
So the hospital fee is just under $1,300. We do also charge a fee for keeping the eggs frozen. It's the first fee you get is after 6 months. So it's not a fee you're charged on the day, but after 6 months, you'll get this fee every 6 months. It's $280. It's a flat fee. So it's not $280 per egg.
Or okay. So just for your storage, you can have as many eggs in your little storage basket as you want. Okay.
And if you do 3 rounds of egg freezing, we don't charge you 3 separate storage. Right. It's just all consolidated into the one fee.
Yeah, cool. I have a question about Medicare versus non-Medicare. I know you said that, if you're non-Medicare, it's usually because you're fit and healthy and have enough eggs that it's not deemed medically necessary. But if I came to you and said, this is something I want to go through, Dr. Nicole, how does that work? And you were assessing my Medicare criteria, what would I need to meet to be able to fall into the bucket of Medicare? Is that like where you did blood tests and stuff? Is that going to tell me, or is it just?
Yeah, so looking at the AMH and, as a general kind of rule, we would generally consider if you're sort of in the bottom third for your age, that might be considered a reason. When you have your ultrasound, if we see anything else that we know might affect your fertility, for example, fibroids or endometriosis, if you, obviously, pre-cancer treatment is one, but sometimes we have patients who are going to be having a surgery to remove an ovary or a cyst, or if people have a past history of endometriosis, these, or even a history of infertility with a previous partner, or however you were trying to get pregnant. So I think it's just sort of demonstrating that there might be some fertility issues there.
Yeah, no, that's okay. I'm just going to change the slide because I just want to chat about the difference between costs associated with egg freezing and then IVF. Am I right in assuming that the costs are very similar up until that point of egg freezing? Or so how in the cycle before you said there's egg freezing, or if you were doing IVF, you would inseminate the egg. Is that where the costs start to go up?
So basically the extra costs with IVF are related to the fact that we're putting the egg and sperm together and we're culturing these embryos in the lab, and then bringing, actually transferring an embryo into the uterus. And so you can see that at the end of the day, it's a little bit more expensive than the egg freezing.
Yeah, and that makes sense. Like there's more involved, and there's more process involved. Yeah. So when it comes to egg freezing and IVF, are there additional or hidden costs? Like are there, we're explaining it and actually is on the money. We try to be as transparent as possible. And like, here are the costs, you know, you guys actually provided me with this because I did my research, and then, you know, you've added to this to make it really clear around what this looks like. But are there things that I should be budgeting for outside of the ones that are on the list here?
So when you have your first appointment with the fertility specialist, when you have all your blood tests, I do try to bulk bill all the blood tests that I can, but the AMH test is actually one of those tests that Medicare doesn't bulk bill, and most labs do charge about $90 for that one. And then, as I mentioned, I also like to have patients have a pelvic ultrasound. With pelvic ultrasounds, there is a big variety in the quality of the reports that you will get. And I usually will send my patients to have an ultrasound with what's called a specialist women's ultrasound, where they are actually often gynecologists, trained gynecologists who do the scanning. And they're really experienced. And you sometimes going and getting a scan at the sort of local radiology, I do have patients where they have a scan, things aren't clear, and then we have to send them off for a more detailed scan, and they may as well have just gone and got the detailed scan.
They should have gone to womb, like, honestly.
Yeah, exactly. Yeah, somewhere like womb, they're really great.
That's where my OB sent me. She was like, Victoria, I'm just not going to mess around. You're going straight there. And I was like, yes, boss.
So that kind of a scan potentially, like there are obviously some bulk billing scanning clinics, but before starting treatment, in order to have the best information going into it, it's worthwhile getting a decent scan. I think a lot of those scans are somewhere like $350, $400, but there are Medicare rebates that are on those scans.
Yeah, no, and it's good to know, in fact, during my pregnancy journey, I think that my one of the things that shocked me was what ultrasounds cost out of pocket. And like, I was in the privileged position where I could afford that. But I remember saying to my husband, like, oh my goodness, like, this is much more expensive than I had anticipated. Like, it's actually a couple of $100s, and I just thought it would be part of the process. So I'm glad that we were able to have these conversations where it's like, hey, so like, this might come as a surprise. When you have people come into the clinic for the first time and you're sitting them down and explaining this, are you going, okay, cool, so, you know, this blood test will probably be out of pocket and this will look like this, so that they're just like super prepared for the financial journey ahead?
I do try to do that, but yeah, it is.
There's so much to cover in that meeting, I'm assuming.
Tricky. One of the things that we do at Newlife, from the IVF perspective, before anyone commences treatment, they have an appointment with someone from our finance team, and they will sit down and give them an itemised every single fee that they will expect to pay during the cycle. Yeah. So we certainly do obtain financial consent, and people shouldn't be getting too many extra costs outside what they are quoted.
Yeah, and it's going to be different for everyone. In the comments, I can see some people saying, hey, don't forget, like, you know, cost of travel and hotels if you're not from the local area. Like, if you decided, like, for example, you wanted to go to Newlife and you don't actually live near Newlife, but you're like, okay, cool, I feel the safest here. Like, these are all things that we're going to have to budget for. I am obsessed with the fact that you're like, look, talk to the finance department first, because across the board, like, your fees are very reasonable. That is absolutely, you know, the experience of most places. But I feel like lots of places aren't talking about the finance options, because, you know, that can be crippling. So let's talk about how are your patients funding this? Because I think for a lot of us who haven't thought about this before, that we're probably a little bit like knocked off our chairs that it's so expensive to begin with. Yeah. But at the end of the day, it's because it's a really expensive process. So talk me through how most people are financing this.
I can probably plead a bit naive that I don't always sit there and say, where are you getting the money from? But I do always...
That's why they talk to finance first.
Yes.
Like that's not part of your job. They're talking to finance and then they're coming to you completely educated. And as a money girl, I love that.
I do have a lot of people coming in with mums, and I think sometimes they have their mums as just a second set of ears, but I also think sometimes there are parents who are helping with this. Especially if they don't have any grandkids yet and that's on their to-do list. So
that's smart. That's an investment from the grandparents.
Yeah. It is possible to access superannuation. It's not a really straightforward process. With accessing the superannuation, you do have to see a mental health specialist to access that, and so you're only actually able to access super on mental health grounds. So you need to be assessed whether it's anxiety, depression, or something more significant. So we do have patients accessing super as well.
Yeah, and I think that's an important conversation to have, because I've actually spoken on the podcast about being able to access that, and I hope I'm not speaking out of term here, but if that is a reason why you are potentially going to access superannuation to do egg freezing or even IVF, I would actually start the conversation with your GP to talk about a mental health care plan, and then get a referral into, a Dr. Nicole to have a chat about it, because these two things often have to go side by side, not just, your fertility expert deemed you to have, you're going through mental challenges.
In actual fact, I'm not allowed to.
Exactly. There we go. I was like, I'm pretty sure you're not allowed, but I'm not going to say that.
No, I mean, I can write a supporting letter, just to say that I recommend that the person needs fertility treatment for these reasons, and that in order to access treatment quickly, they do need to do this privately or self-funded. And
that's, what I would talk to your GP about. I've had a couple of people through the She's on the Money community do that. And it's often because of the anxiety and the pressure associated with going, I'm 32 and I don't have a partner yet, and that's causing significant stress. So I think that we need to talk about it. Talk to me about like payment plans. So like if my community were trotting down to Harvey Norman to get a furniture package on a payment plan, out the door, absolutely not. Like that is not something I can recommend. However, a payment plan for fertility treatments, I feel like that is something that I go, you know what, I get it. I feel like sometimes you don't have the cash, but as you were saying before, you're kind of like, if you do it at 32, you're going to have the eggs of a 32-year-old person instead of waiting until you're 37. And these are things that we can't save up for because you can't go back to 32, right?
Yeah. So in terms of the fees, there's usually a part payment when you commence the cycle, and then there is another payment just before the egg collection. And once the egg collection has happened, we submit the invoices as soon as possible to Medicare, and usually the rebates are processed within a week or two. So it is actually quite a quick turnaround to get your Medicare rebates. At Newlife, we will accept payment by credit card and BPay. In terms of some of the other sorts of, finance, like, what are they, like Zip and we have looked into those options, but they do carry very high interest rates, and I think we have really felt uncomfortable that someone is doing this treatment, which I'm not saying that you don't need it, but you're doing it more as an investment rather than this is something if you don't have it, you'll die kind of thing. And it can put a lot of burden on people then to be stuck with this fertility bill and paying high interest rates on it. So we haven't gone down that route because we ultimately, if this isn't something that you can afford, then maybe it isn't actually the right treatment for you. But then maybe you can speak with your doctor about other fertility treatments or what other options are. In some states, there are public hospital options as well.
Yeah, which is really cool and unfortunately not Australia-wide. But, you know, I speak a lot about it on the podcast because it's obviously like it's a highly emotional topic. Like it's not something that you go, oh, I could do without that extra coffee. Like it's not that. We're talking about your fertility, which can be incredibly sensitive. I think if it's something you're worried about, like sitting down, doing your budget, understanding that this is a value for you and maybe creating a dedicated fertility fund. I think setting really realistic savings goals and timelines is really helpful, but that doesn't mean you don't engage in the conversation. I think, you know, reaching out, getting all the information, pulling it together, going, this is what it might cost, maybe even doing the investment at the start and getting your AMH levels tested and having that initial conversation could be really helpful. If you do want to go down the financing option, obviously you could reach out to a broker and to be honest, in this situation, I would talk to a finance broker so that you can go, what would it cost? How would that work? Like, what is the best potential personal loan? Because I do, in the same way as you, Nicole, feel quite uncomfortable about a lot of the financing options, which I feel are a little bit predatory because they know that you are really wanting this option and they make it super easy and they often have really high interest rates associated, and you might have been better just getting a personal loan from your bank. I'm not recommending going into debt for this, but like if we're going to talk about it, I'm going to give you all the options so that you can make the best decision for you, so that you are not feeling like, oh my gosh, like, you know, I did this webinar and they both said they didn't like it, so they didn't educate me on it. I think the important thing here is the options that are usually medico-specific have very high interest rates associated, and you would be honestly better off going and talking to a broker about personal finance options. I have done that a few times through my business, but it's one of those things that, you know, other brokers similar to you, other people might offer it really happily and not question it, but I will sit you down and be like, it's none of my business really, but like, let's make sure that you're not getting into crippling debt that then causes you even more stress. So I think that that's important. And then obviously let's talk about, you know, future costs, like what is embryo storage ongoing going to be? And we've discussed that, you know, if you need additional cycles, are you able to afford that? I want to know, and it's been in the comments, Dr. Nicole, does it cost money in Australia to get a sperm donor? Like if we've decided, you know what, we can do this on our own, I would love a sperm donor. What does that look like?
So it does cost to get a sperm donor through an IVF clinic. Certainly I, you know that there are people who find their own sperm donor and do a bit of DIY turkey baster at home.
There's nothing sexier than a turkey baster.
So with our sperm donors, we don't actually pay them to donate sperm, but they do need to have medical assessment. They have to have counselling, a few sessions of counselling before they proceed to make sure they understand all the legislation and understand what being a sperm donor means. We do a whole lot of blood tests, including infection screening, but we also do genetic screening as well. And then obviously we've got to get sperm from them and freeze that sperm to be used by people. So there are
there's clearly a lot of costs involved. It's not just about getting the free sperm. Okay, but I feel like that feels a lot more ethical that they're not paid. Like that someone's not just getting paid to go and do this process, because to me then it feels a little bit more altruistic. Is that how you guys feel about it?
Yeah, and that's what our sort of in Australia sperm donors, it should be an altruistic donation.
Yeah, and that's fair. What type of cost is that? Are we talking hundreds? Are we talking thousands? Are we talking hundreds of thousands? Like what does that look like?
Generally, when someone selects a donor, there is kind of, I suppose, an initial fee to, I suppose, secure that donor, and then there is like an ongoing fee every time you use that sperm. But that ongoing fee, it's only when you use the sperm, and it's much less than the initial fee to sort of, I guess, in a way, secure the sperm. So when we're talking about sort of securing the sperm, it's then making sure that the sperm donor you choose, that you and the donor don't have any matching genetic conditions.
Yeah, yeah, that's smart. But you're not cousins. Yeah, that would be ideal.
Well, we don't know about cousins, but yeah, just making sure that your children won't be at risk of any genetic conditions. So often that kind of initial securing fee is sort of, around, I think, 1,500 mark. Does that sound about right? Do you know? Yeah. And
it's good to know, because I'm like, how much does this cost? Like, if I decided to have a baby on my own, like, is that, do I have to save up $20,000? Like, I feel like $1,500 for you guys to go through all of that and look after it, plus whatever is associated, feels quite reasonable.
Yeah. But having said that, you pay that for the sperm, but then you're also paying.
Oh, you're doing the whole cycle. Yeah, absolutely.
Or it's an IVF cycle, or whether you're doing an insemination cycle. Yeah. Some patients come through with their own donor, and in that case, obviously, they don't pay when they use the sperm, but nonetheless, we still do the counselling, we still do all the genetic testing and screening of all that. So there are fees associated with that. But if someone can bring their own sperm donor, that will save them some money.
It's just so interesting to understand this process that I've never been exposed to, because I wouldn't have known. And honestly, if I wasn't married, I'd be like, oh my gosh, this is absolutely what I need to do. And I'm very lucky that I fell pregnant naturally, because, for a long time I was told, oh, Victoria, and this is probably too much information, but you get what you get in a fertility presentation. Because you had an eating disorder, and a relatively significant one when I was younger, there was always questions about whether I would be able to get pregnant. And so it was a breath of fresh air when I did, and so good. But at the same time, like, I just am so glad that these options exist, because I think in the back of my mind, I was like, okay, well, if that happens and we aren't successful, there are so many options. And I just, before I got pregnant, I would have loved this webinar. Honestly, this has been made for past Victoria. We have a number of, I hope you're okay with this, but we have a number of questions that came up in the comments section, and Jess has very kindly queried them, or like coded them, so that, if there were any duplicates, we're getting there. Is it okay if I go through a few of them with the 10-ish minutes that I have left with you?
Yeah. Absolutely.
So we did get lots of questions about, does XYZ condition qualify you for Medicare? What's the best resource for people to look into, so they might, before talking to you or talking to a fertility specialist, understand what may or may not include them? Is there a website or a document, or do they just have to book in and see a fertility expert?
I think they have to book in and speak with their specialist. The reality is there's not like a list of conditions that qualify you, or a list of things that exclude you. So it's more the doctor's assessment of your situation.
No, that's perfect. Now, how do you choose the right fertility clinic for you? Like, if I'm going down this route, I feel like so many of us haven't been exposed to, you know, even understanding where to go, what to do. I mean, I feel like until recently, it's been a very closed conversation. Like, if you did IVF, I remember when my mum's friend did it, like way, way back when, you know, I was little, and it was all hush hush, like, oh yes, she had IVF for her kids. But now it's all very in the open. But how do we know where to go? Like, how do we choose the right clinic for us?
So I think it's the latest stats say that 3 kids in every classroom will be IVF conceived. And so, as you said, lots of people are doing IVF. So I think maybe a good place to start is to talk to your friends and family or work colleagues and suss it out. And I think it is still something that people don't always talk about, but I think once you lift the lid, you will find that lots of people have been doing it, and you will get opinions from people. So, you know, I actually find I do. Some of my patients come from GPs who refer to me regularly. So if they have someone come to them who doesn't want to talk to anyone about it, or, you know, just wants to see their GP, usually the GPs will have doctors who they have experience with and will refer to. But I also, get a lot of people who say, you saw my sister, you saw my friend. And so a lot of word of mouth. So I think
I feel like we get that a lot, because like I knew of Newlife before we got involved, because I've had friends go to Newlife. So when, you know, this beautiful partnership happened and I was talking to my team about it, I was like, oh my gosh, like I'm already on board because of the positive experience I've heard about through my friends. And I just think that's, you know, that's the best way, in a way, to go, oh, well, I know that my friend had this, and so therefore, like, I'll get the same experience, which is just so nice, right?
Yeah.
So another one of the questions that we've got, and I think we covered it before, but what are the cutoff ages? So I think we spoke before about how 40 is probably the age at which you go, we shouldn't be freezing eggs after that. But is there a band? Like, you don't freeze eggs earlier than a certain point either?
So if, for example, we're doing IVF where someone's actually having an egg collection and creating embryos and trying to get pregnant, at Newlife, our cutoff is 46 years old for actually having an egg collection. As I did mention before, I have had some ladies who are in their early 40s where we have proceeded with egg freezing. Generally, I do want them to have a pretty good number of eggs. So some women are older, but they actually have very good ovarian reserves, high AMHs. Their egg quality is like, your egg quality really does correlate with your age. So if you're 42 and you've got as many eggs as a 22-year-old, that's good, but your eggs are still 42-year-old eggs. But I think to really
you might have as many, but they're like wrinklier.
Correct.
Okay.
To kind of make it worth it, if you can't do much about your egg quality, but if you get a lot of eggs, then there's a better chance that there will be a good quality egg in there. So basically, you know, under 40, you know, the egg quality, it is decreasing sort of from your mid-30s. From 35, we do see every year there are decreasing pregnancy rates, but the rates really start dropping off from 40 onwards. Yeah. So as I said, at our clinic, we don't have a strict cutoff for egg freezing, but I'd be very not really super keen to freeze eggs after sort of 41, 42, because it's really hard to get a baby from frozen eggs at that age.
Yeah. Another question that we got, which I was like, oh, I didn't even think of this, is are the eggs that, you do collect,
Mm-hmm.
are they checked before they're frozen as to whether they're viable or not?
So we look at the eggs, and we only freeze the eggs if they are mature. And so only a mature egg has the capacity to be fertilized and form an embryo. So we do look at them, and we won't freeze eggs if they have no chance, but we don't actually know if that egg is genetically or chromosomally normal. We don't have the capacity to test that.
Yeah, and sorry to butt in there, that's not because it's your clinic that doesn't have the capacity.
Oh, yes, that's
in general, you cannot test that.
No.
Am I right in saying that you have to wait until you have an embryo to be able to test
that? Exactly right. So basically an egg is a single cell. When
you can't need the whole thing.
Like when we put back an embryo at day 5, after 5 days of growing, it has over 100 cells. And when we're doing chromosome testing, we actually have to physically remove 5 cells from the embryo.
Yeah, right. And so that's way too significant.
Given the egg is just a single cell, you can't do that.
No, it's so interesting to know why as well. Like, I'm one of those kids. I was so annoying at school. People would be like, this is the math problem. And I'd be like, yes, but why? So I do apologize.
Yeah.
Someone has asked, what's the youngest age you would suggest for collection? Like, is that a thing? Like, are we, if I'm a really optimistic 21-year-old, like, am I meant to come and talk about this stuff? Or like, at what age are we meant to discuss this?
Yeah, so I guess I would say what I was just saying before, we do see your fertility decreasing from a young age, but the decrease is very slow and slight up to the mid-30s. And then it just becomes a bigger and bigger decrease every year. So if I see someone at 30, and they have a good number of eggs there, I will sometimes say to them, I don't think you need to do anything right now, but maybe if you are still not ready to have kids at 35, 36, maybe come back and freeze then.
Yeah, that's fair. That's fair. And I feel like that, again, it's frustrating, I know, because I think, I would love to be able to give everybody individual answers, but at the end of the day, fertility is so personal, and like, you need to go and have these conversations if you're worried about it. And I mean, for me, I would assume that those conversations can start at the GP. They can start with your GP, who can then, obviously refer you to somewhere like Newlife if they deem it relevant, or they might say, look, you're very, very young and we could do these blood tests just to test a few things. Is that right?
Yeah, that's right. And also just going back to someone's personal history as well. So someone might have a good AMH, but maybe in their family, all the women went through menopause at 35. And so that might be a reason why even if the tests are normal, if they have that family history, you might say, you know what, we are going to freeze eggs when you're 25.
Yeah. And now I have one last question. I know I don't have much time left with you, but I feel like this is a good one. Does the quality of someone's life affect the quantity and quality of their eggs? So I've got here an example, like if you're a non-smoker, non-drinker, at 35, are you going to have, better quality eggs than someone who is?
Sure. So, yes, you should, theoretically. So what we know is definitely things like smoking. We know smoking not only affects egg quality, but also actually does destroy eggs and makes you run out of eggs quicker. Obviously, we know issues with your weight, whether it's being extremely overweight or even underweight, have an impact on egg quality. And sometimes even having other significant medical problems can have a negative impact as well. So definitely being as healthy as you can will put you in the best possible position. But at the same time, there are some people who are really have always been very healthy and done all the right things, and they do have very low egg numbers, or they do have poor egg quality that just seems to be unrelated to their lifestyle. Yeah. So yes, definitely everything else you do in your life will overflow to your egg quality, but at the same time, there are still some things you can't control, unfortunately.
Yeah. Now, I'm very close to running out of time with you, so I do apologize. This has been so good. I don't know. I should have asked you before I mentioned this, but I feel like you might be okay with it. When I was thinking about getting pregnant and going through that process, I read a book called It Starts with the Egg.
Yeah.
And firstly, before we carry on, is that a book that is a good reading resource for people, or like is that looked down upon it by the medical community?
I think it is good to read it. Just, you know, as you've said before, having more information is always better. And look, some people might read that and they might be like, look, I already knew all this stuff, and they may not find it very helpful. But for other people, there can be things where, they just need it spelled out to them. Hey,
well, I liked it because I felt
like not a good thing. And
I just felt like it made me feel more educated. It didn't mean that, you know, I don't know if you can change egg quality, but I definitely was, you know, I picked up taking folate and I was like, okay, I'm going to take that earlier just so that I have enough of it in my system. And things like that were really helpful. I have loved this chat. I feel like there are lots and lots of questions that we haven't answered because they just kept coming in hot and fast, which just tells me this is a topic that our community are very, very interested in. And I'm assuming everyone here, including myself, is very grateful for your time tonight. There have been incredible questions. Don't worry, guys. If you tuned in halfway through, I think there was somebody also called Rebecca that tuned in halfway and said, I had a noisy toddler. I could not join until now. The replay link will be going out after this. So we'll send that out tomorrow, as well as a whole handbook, which has like a lot of Q&As from Newlife IVF detailing the process and what's going on. And then for anyone who's based in Melbourne and you've loved having a chat with Dr. Nicole as much as I have, you can check out newlifeivf.com.au and have a look at her, or even book an appointment with her clinic just to have a chat about these things. Because for me, this was a really overwhelming topic. So it's so nice to kind of put a face to it and go, oh, you're lovely. That would be so easy sitting down with someone like you. So it's been very educational and very helpful. I'm really grateful for your time. So thank you so much, Dr. Nicole. It has been a pleasure.
Yeah. Excellent.
Thanks so much, guys. I'm going to disconnect it and have a beautiful evening. And we will hopefully, Dr. Nicole, see you at some point for another webinar.
Excellent. I'll be there.
Bye.